I think it's incredibly sad that some California cities have chosen to deny their very own citizens safe access to medicine that their doctors recommended to them. It's even more sad that the justice system in the state of California is allowing those cities to do this action. The court's decision leaves patients in communities that have banned cannabis with no other option than to go to gang and cartel-related sources in order to get their cannabis. To me, that just doesn't make any sense. I can't imagine that there's any elected representative or any judge that would think that it's better for patients who already have a legal right to use cannabis as medicine to get that medicine from criminals instead of from licensed and regulated facilities. So I think that the decision is going to both put patients in the path of danger, because patients who have epilepsy and cancer aren't going to stop using the only medicine that helps them. They're going to get it wherever they need to. And because they're going to have to get it from criminals, from unregulated sources, communities are also going to be placed in danger. So I think that the bans, if they are motivated by a sense of a desire to protect public safety, are counterproductive. And I think that the decision by the California Supreme Court is going to really harm the communities that have bans rather than helping them. And it's certainly going to put patients in the path of danger. At the same time, it's going to enrich and empower some of the most problematic parts of our society. Why do we want people who are running around our streets with weapons and shooting up our cities to be selling cannabis and making money off of it? You know, in Oakland, Harborside Health Center is the second largest retail taxpayer in the entire city. We've created over 100 well-paying jobs. Why would any city rather see those resources go to the criminal underground? I have a very difficult time understanding, and why any court would allow them to make a decision like that. I have an even more difficult time understanding. The decision by the court really underscores the need now for statewide regulations in California. Prop 215 was passed 17 years ago. The proposition itself called on the legislature to pass statewide regulations to ensure an orderly cultivation and distribution of cannabis. The legislature hasn't done that, and as a result we have this very chaotic, very disordered situation that nobody really understands. That's one of the reasons that cities have banned cannabis instead of trying to regulate it. So I think it's really time for the Assembly to show some leadership, step up to the plate, and do what they should have done a number of years ago and figure out a way to safely and responsibly distribute cannabis to the patients who need it, no matter where they're located in our state. Clearly well beyond time for a change at the federal level. A very good first step, which is something President Obama could do with an executive order tomorrow, would be to remove cannabis from the schedule of controlled substances. Cannabis is currently a Schedule I controlled substance in the same category with heroin and LSD and PCP. Cannabis clearly is not only not a dangerous drug, but it is also a very valuable medicine. So it has no place in Schedule I or anywhere on the schedule of controlled substances. So the first thing I'd like to see is the president to sign an executive order removing cannabis from those schedules.